There we go. So as I said, we are going to record it and it will go onto our YouTube channel so that you can always watch it again if there are some things in it that you don't quite capture the first time round. The chat panel is enabled, as a number of you found out. So if you do want to communicate with Deborah and I during the webinar, please do put any questions or comments or thoughts in the chat panel. And I will do my best to monitor it as we go along. And if there's anything in that I can share with Deborah as a question, then I will do that. So I'm delighted to welcome Deborah, who, as I said, is a member of our alumni and executive coach, and has a very particular interest in ADHD, which we will come on to. But just by way of an introduction, I'm going to have to look down for this, Deborah, because I need to make sure I get it right. So Deborah is a consultant clinical psychologist. She is also a research consultant at UCLH and Derwent Valley Hospital, and also a professor of pediatric and adolescent psychology. I think I've got that right. And of course, an executive coach. So Deborah, delighted that you're with us. Just what would you say, or what would you like to say as we sort of kick off and head into our conversation?
Well, I guess it's just, I feel really privileged to have been invited to be in one of the webinars, having done the coach training with you, Liz and Damien, and I feel very grown up actually doing the webinar. So thank you very much for asking me. It's lovely to be here.
Yeah, well, some of you who were listening, and just before we got started, Deborah and I were saying, so there was a webinar that we did last year on neurodiversity. It was a particular focus on autism and the autism spectrum, and it sparked such a lot of interest that, you know, you got in touch, and hence we've got this one as well around ADHD. So we know it's a topic that's really a lot of interest to a lot of the people out there in the coaching world. So, and I can see, so we're up to 70 attendees. So welcome everybody who's called in. Well, so let's just dive in, Deborah, and sort of get started with what your particular interest in it is in ADHD, and what brings you to want to be supporting people with ADHD through coaching.
Yes, Liz. Well, kind of my life's gone a bit of a full circle. When I started as a clinical psychologist, I was working with young people with Tourette's syndrome, who a lot of whom also had comorbid ADHD. And I also worked in eating disorders and medically unexplained symptoms. And there's a very high incidence of autistic spectrum disorder in those medical conditions. And over the years, I've continued to be involved with that, but I'm now the executive director of Help You, which is an online therapies platform that offers ADHD coaching and clinical psychology support to individuals that have been diagnosed through Psychiatry UK. So the majority of our clients on that platform are neurodiverse.
Lovely. And I mean, we will talk a bit later, because you mentioned comorbidities, so that is something that we'll come on to, is because often some of these conditions can, not always, but they can go together. So just say a little bit about the difference between ADHD coaching, which you've just mentioned, and coaching someone with ADHD.
Okay, so both of them require you to have good coaching skills. You have to understand the non-directive approach and be able to think with people about what they want for their goals. With ADHD coaching, you are working with somebody who has just had or recently had a diagnosis of ADHD and wants coaching to help them understand the symptoms and the experience of having lived with the symptoms, often undiagnosed for many years. So whilst the coaching format will be similar, you'll be using a sort of similar T-GROW format, you will also be working with the client on understanding the symptoms using psychoeducational approaches. You will also potentially be thinking about skills training and thinking with the client of what kind of skills training would they like in order to manage the symptoms, and then potentially at some point you may also be working around emotional acceptance or understanding of how these symptoms have impacted on you. And there are lots of people who don't get a diagnosis well into their 50s. So it can be a really traumatic experience to be diagnosed, and the ADHD coaching is focusing on that particular aspect. It's that you're working with.
Okay. And as you say, that's very specific for people who have had a diagnosis of ADHD at whatever point it comes.
Yes.
And I do know what you mean, that as you say, you can get that diagnosis at any point during your life. And it can be my sense, it can be a relief for some people because suddenly it makes sense. And as you say, it can be very traumatic too.
It is people do talk about it being an enormous relief. Everything sort of falls into place and you suddenly understand, I'm not a bad person. I'm not stupid. There are reasons why things have been a challenge and a struggle for me.
So as you say, that's a very specific approach. And as you say, I'm imagining you would need to be well trained, particularly in some aspects of ADHD, to do that.
Yep.
So you might want to say a bit about that, but also how is that different to coaching someone with ADHD, which is probably where quite a few of our audience may sit?
Yeah, so coaching somebody with ADHD is really no different to coaching anybody. You want to know, what does the client want to achieve? And you want to know, where are they going? So you're following their lead. The difference is that if they've told you that they have ADHD, and this is quite important, if they've said to you, I have ADHD, but I want coaching on how to manage a new job. Let's just say that, for example, I've got a new job and I want some help. I do have ADHD. Then you would, as a coach, you'd say to them, so what do I need to know? And you would ask them those sorts of questions in order to think about, where does the ADHD fit into this? So you would want to understand what's their knowledge of ADHD and which are the bits of ADHD that may or may not impact on the work that you're doing together. But there equally will potentially be some aspects of the ADHD that might make some of the bits of your coaching contract a bit more of a challenge, and you need to negotiate and think those things through.
And I wonder if it might actually help people to hear, because we've dived into the conversation, but actually to hear, what is ADHD?
Okay.
What would be a definition of it?
Okay, well, the very, very quick one is that, first of all, it's a lifelong neurodevelopmental disorder. So everybody will have had this from birth. The brain develops differently in somebody with ADHD. It matures more slowly, particularly in areas like the prefrontal cortex. So there are structural differences and there are chemical differences. And the sorts of difficulties or challenges that people with ADHD will have experienced and will continue to experience are around attention, hyperactivity, impulsiveness, often controlling emotions or emotional regulation, organization, time blindness, for example, is something that you can experience with ADHD, where you just can't manage time. So you may be late for appointments or very, very, very early for appointments. Working memory. You can lose things or forget things. One of my friends makes cups of tea and never drinks them because they're always making the cup of tea, putting the tea down and then forgetting that they've made the tea. So they go an entire day and then at the end find about 5 cups of tea scattered around the house. And there's also something about struggling with rejection or being ignored, which is rejection sensitivity dysphoria. And that's a really intense experience. It's like, again, one of my colleagues that I work with describes it as emotional sunburn. It's where somebody's saying something to you that wasn't intended to be highly critical is experienced as incredibly critical. But one of the things I want to say, which was already said on your other seminar webinar, was when you've met one person with ADHD, you've met one person with ADHD. Everybody is different. And as a coach, you need to explore what's unique to that individual.
Lovely. And I've just seen a question on the chat panel, actually, which I will bring in. So Penny, welcome Penny, who says it is difficult to diagnose, especially among women and girls who may not have the same symptoms. So yeah, what would you say about any gender differences?
Yeah, so certainly women, similar with autism, there's a lot of masking. So women tend to do a lot of masking, and there's sort of slightly different sets of symptoms that go together. The core symptoms are the same, but there will be sort of slightly different expression. And so it is really important to remember that, and to read up and to understand it. And so, for example, things like the menopause, just as that has an impact on everybody, well, not everybody, all us women, but with ADHD, it can have particular impacts. So it would be useful to go and understand that. I just see somebody says it's also a spectrum. It is, but I think the important thing is that, you know, if you've got ADHD, your brain is different and you will have a really high intense level of these symptoms. Everybody forgets stuff. Everybody can forget things. Everybody can be a bit disorganized. But one of the things that somebody with ADHD finds unbelievably frustrating and annoying is when somebody says, oh, I do that all the time too. I wonder if I've got ADHD. You really shouldn't say that. And it's really unhelpful. We all do stuff, but it's the intensity and frequency with ADHD that differentiates it as a very specific condition.
Yeah, thank you. And of course, I'm imagining, and I'm checking this with you really, that because I have had a client who's disclosed that they have ADHD, but has obviously learned to cope and manage with it.
Yeah.
So I'm imagining there are different levels of, or it can be different the extent to which it interferes with someone's ability to function. Would that be true?
That is true, and it may depend how long you've had it. So, you know, somebody has been diagnosed and has for a long time and has had, you know, maybe has had some coaching or has had some therapy, has done a lot of research, has understood the things that they need to do, then they may be very good at managing certain aspects of it. But that still can be exhausting, and it can be very, very tricky. And some people, I just noticed that somebody put something in about gifts and strengths. That's a really interesting thing. There are definitely some people who say it's a superpower, you know, and there are other people who actually get very upset at that idea because actually it's had a really big impact on them. So you can harness some of the aspects of it, and use them to your advantage, but on the whole, it tends to make things very difficult for you until you understand it, and then you can start to work on it. And then maybe some of those things could be your personal superpower.
And you mentioned earlier, I think you used the term comorbidities. So what can go with it? Well,
ASD can go with it. So it's not unusual for people to get an ASD diagnosis as well as ADHD. That's quite common. There can be a lot of things like depression and anxiety. So, and that's often, I think, a reactive condition that, having lived with the challenges for a long time and not understood or had a diagnosis, that you'll end up really struggling, and you can have quite low mood. So that can also be a comorbidity. Tourette's can be a comorbidity, or tics, just some tics, and other neurodivergence conditions like dyslexia, dyspraxia, dyscalculia as well.
Great, thank you. So I also want to come back to the coaching lens as well, because I think it's really helpful, as you, Deborah, to have that clarity over what it is and how it can impact people. what are some of your experiences of coaching people with ADHD, rather than coaching someone specifically around their ADHD, but coaching someone with ADHD? What would you share?
I had a client who I had a client who had ADHD, and I think one of the things that's really important is contracting. Now, there's a surprise. So I still, remember, always be contracting. I think you really have to do that even more with ADHD. Things like making sure that you understand how those symptoms affect them personally and how they might impact on your coaching relationship. So things like appointments, forgetting appointments, or turning up to appointments late. So having a conversation around that, and how do we manage this? What are we going to do to manage it? And there are lots of tech help you can get there, things like using a calendar system that allows reminders to be sent. That can be quite useful. And not just the day before reminder, but an hour before your appointment reminder, for example, can be really super helpful. But you have to discuss that with the individual. What are the other things? So I've got a little list of things I didn't want to forget. Oh yes. Remembering the RSD is really important. Remembering the rejection sensitivity dysphoria thing. So homework, for example, if you do set homework or suggest that somebody might want to try something out in between sessions, there is a chance it won't get done, potentially, if somebody has organizational issues, and they might just be very busy. And so whereas with one client, you might say, oh, no, not again, which is a joke because, they haven't done it. If you said that to somebody with ADHD, they could take that to heart and be so upset. One of my colleagues, for example, he finds it very hard to say anything assertive to people. And so, for example, if you're asking people and somebody's got ADHD, how's this session going? They might be, oh, it's great, it's really, really good. So that, being careful about how you do your evaluation, so that you give people an opportunity to give honest feedback in a way that, because not only do people with ADHD find it difficult to receive criticism, they also really find it very hard to give it as well, because they're worried you'll also be upset. So it's about using your coaching skills. This is the thing. There's nothing different in that sense to anybody else. You have to use your coaching skills in a way that's non-directive, that's inviting people to tell you, what do I need to know about you? What do I need to know about how we are going to work together? And constantly contracting through that.
Yeah. And I know, you and I have talked, and you've said many times, of course, our role is definitely not to diagnose. I know people will know that, but I think it's really important to say, because so many of the things, as you've described, are facets of life for lots of people. I'll definitely forget a cup of tea, for example, but I really hear that's that's not what it is. So,
yes, and that's super important. And it's sometimes we use those sort of like jokes that like, oh, my husband's so autistic because he's always organizing the CD cases, that sort of thing. We've just got to remember that we're not there to diagnose somebody, and even if we think they might have a lot of the symptoms, then that's something you can explore with them and ask them what do they think that's about. But definitely being very careful not to say something like, do you think you might have ADHD?
Yeah,
I would say.
Absolutely. Yeah. What's been your biggest piece of learning, Deborah, from coaching people with ADHD?
Biggest bit of learning, definitely never assume what the right way is, and the biggest bit of learning is make sure you ask, how do I do that, how do we work together? So one client one colleague I work with, for example, told me how much he struggles with working with somebody when they give feedback when he doesn't ask for it. And so I've learned that when I work with him, I always say to him, so what do you want any feedback on this? And if so, what kind of feedback would you like? And that's enabled him to say, yes, please, or no, thank you, or this kind of feedback. So asking, not being afraid to ask and acknowledge that that you don't know them as well as they know themselves.
And I think there's also something, as you said, as a coach, when you're, that can't always be contracting. That's what we say, don't we? The ABC coaching.
Yeah,
always
absolutely.
be contracting. And there's something for me about really being in the moment with someone. So, if they are sharing something about how it shows up for them, and as you say, there might be something about how they find giving or receiving feedback, that you really try and support them in the moment. Well, what would it be like if you gave me a bit of honest feedback? Let's just try it. And what's happening for you as you do that. So it's really supportively and at times gently trying to really sit with them with it in the moment.
That's nice. And checking in with people how they're arriving, I think that's also something, because of the emotional dysregulation, an individual with ADHD may have just come from a really difficult meeting and may be feeling completely raw or ragged. And so that, that question, how are you arriving today? What do we need to do in order for this session to work well for us? What do you need from me? All of those arrival questions that allow people just to arrive and settle and sit, and checking out, do you like mindfulness? Do you like breathing? What is it that you need to do in order to just they might need to move as well. You might, they might say to you, well, I need to move. So you might have to get used to the idea of saying, we've been talking for 15 minutes. Do you need a movement break? Or even ask, would it be okay? Do you want to do the coaching walking? Do you want to do the coaching moving? Shall we walk together? Do you want to go for a walk and we'll talk whilst you're walking? So those sorts of things, because movement breaks can be really helpful. And sometimes people with ADHD can struggle to sit still for a long period of time before they start to get it. But again, that's just them, one person. It's not every person. And so you can't just say, oh, well, I've read a book about it, and so I know everything that there is to know.
So there's loads of questions. I can't keep track of them, but it's lovely that it's generating so many. I think the other thing, just listening to you, Debbie, the other thing really it's connecting me with is, that really holding that non-judgmental space, because I heard the piece you said about the organisation, that people might struggle with that. So how are they managing the session, arriving for the sessions? Are they able to keep to the times? And of course, it's remembering it's very easy as a coach to layer all kinds of assumptions into that, and being really mindful of staying non-judgmental to what's showing up with your coach or with your coaching. So we're heading towards the end. So we will put some, I'm going to give Deborah a chance to point to some resources. So I know there are a couple of questions in the chat panel around it. So we might have already covered it, Deborah, but I'm going to give you a chance to start bringing it all together. But what would be your top tips for anybody working with someone who either has said that they have ADHD or just, may have some of the sort of signs of ADHD?
Do your homework, learn about it. I don't think you have to have ADHD to be a good ADHD coach, or to work with somebody with ADHD, but you have to understand it, and you can understand it by talking to people. I work with people who have ADHD. I have learnt all the most interesting and most helpful things have come from working with them and asking them questions and saying, help me understand, how do I work with you best, and what do I need to know, and tell me what's useful. So that's good. There's some great podcasts out there. it's in the chat. You put it in the chat, but it's www.adhdadult.uk. It's very sweary, so that's the health warning. But James and Alex are academics who medical biology academics who co-host the ADHD Adults podcast. It's also a registered charity, which is ADHD Adult UK. And that does coaching, policy making, evidence-based psychoeducation. The podcast is hysterical, really clever, very funny, but as I say, extremely sweary. There's also ADHD UK, just basic ADHD UK. That's a big charity. Loads of great resources on there. I noticed that there was a question in there about neurodiversity in the workplace. There are lots of good ideas around that on ADHD UK. They do courses around how you can learn, how you can make sure that the way that you work with somebody is as neurodiverse friendly as possible. Lots and lots of tips on there. There's also there's a very good NHS website, actually, which is Mersey Care. I haven't given you this one, Liz. I'll just pop it into the chat here. Hang on quickly. What's the best? I'll put it into you and then you can forward it.
Yeah, I'm just checking actually whether people, I'm not sure whether people can see it.
It says to host and panelists.
Yes.
So that's basically, I mean, if you go onto Google, you know, Google's fabulous. Just put what's neurodiverse friendly, how to make communications neurodiverse friendly. There's loads of stuff that will come up, and they're good. And I think it's just, you know, you said what's been most helpful, just been really learning and listening to people, and understanding that the best way to help somebody is not to tell them what to do, but to ask them what works best for them and to help them put that into practice. If you're doing very specific ADHD coaching, so if you want to be an ADHD coach, you should have a proper accreditation. So I would say being a good coach first and foremost is the very, very first good step, but then layer it with some ADHD knowledge, either using one of the ADHD training courses that there are around. Psychiatry UK is a great place to go to get a diagnosis if you don't want to wait 5 years in the NHS, but you can get it through Right to Choose. So it's not that it's private, it's NHS, but it's a Right to Choose company, Psychiatry UK, and they, you can, if you want a diagnosis or you want to send somebody, then that's a good place to go. I think that's probably all the info that you need. Is there anything I've forgotten?
I think that's yes. So we're trying to, for some reason, it's not letting me put it into the chat box. I'll see if I can sort that out. So one thing I would say is that Deborah and I were chatting earlier. So Deborah is very happy for, I think we managed to do it, people to contact you through LinkedIn, I think. So if you are interested, as you can tell, Deborah's got a lot of knowledge in this area and a lot of resources that she's happy to share.
Yeah, done it.
You've managed to get the chat
yeah,
panel.
so
Well
those are the links. But yes, if anybody's interested or would like to hear more, or if anybody's interested in becoming an ADHD coach, then just get in touch with me on LinkedIn.
Lovely, thank you. So thank you, Deborah. A huge, you know, I think it's half an hour's whizzed past. It feels like we could
I can't
carry
believe
on.
it. Half an hour. Wow.
So, and thank you everybody for joining us. I really do think this whole area of neurodiversity is an area that we're going to keep coming back to, because it's really, you know, causing a lot of interest, sparking a lot of interest, and really helpful for people. So thank you, everyone. Go well. And
thank you, everybody. Thank you for having me, Liz. This was great. I really enjoyed it.
A pleasure, a pleasure. So I will pause the recording. Don't disappear anywhere.